Have you ever wondered what it's like to experience a mind that won't stop worrying about a door being unlocked or hands being unclean? This is a glimpse into the life of someone living with obsessive-compulsive disorder, commonly known as OCD. OCD is a chronic and long-lasting disorder characterized by uncontrollable recurring thoughts, also known as obsessions, and behaviors known as compulsions that an individual feels the urge to repeat over and over. These obsessions might center around a range of concerns, from cleanliness and safety to order and symmetry. Compulsions, on the other hand, are the repetitive actions driven by these obsessions, such as excessive hand washing or repeatedly checking if doors are locked. But OCD is more than just being overly neat or organized. It's a serious mental health condition that can disrupt one's day-to-day life, causing significant distress and even impairing a person's ability to function at work or school or in their social life. OCD, therefore, is more than just being overly neat or organized. It's a serious mental health condition that can disrupt one's day-to-day life. So, what causes someone to develop OCD? Well, the answer is complex and multifaceted. A variety of factors can contribute to the onset of obsessive-compulsive disorder. One of these factors is genetics. Evidence suggests that OCD may run in families, hinting at a genetic component. This doesn't mean if a relative has OCD, you're guaranteed to have it too, but it may increase your susceptibility. Biochemical factors also play a role. Some researchers believe that abnormalities in certain brain structures or functions might contribute to OCD. A lack of the brain chemical serotonin, for instance, has been linked to the disorder. Environmental factors cannot be overlooked. Stress-inducing life events, such as a major loss or change, can trigger OCD in people who are predisposed to it. Finally, there's a possibility that certain infections can lead to the onset of OCD, especially in children, but this theory is still under investigation. While the exact cause remains unknown, it's clear that a combination of factors contribute to the development of this disorder. Well, who is more likely to develop OCD, you might ask? Well, there are several factors that can increase the likelihood of someone developing obsessive-compulsive disorder or OCD. One of them is a family history of OCD. If you have a parent or sibling with the disorder, your chances of developing it are somewhat higher. This suggests that there may be a genetic component to OCD. The age of onset is another factor. OCD often begins in childhood, adolescence, or early adulthood. The earlier it starts, the more severe it might become, and let's not forget about coexisting mental health conditions. People with OCD often have other mental health disorders, such as anxiety, depression, and body dysmorphic disorder. This can make dealing with OCD more challenging. However, it's important to remember that these are just risk factors. They don't guarantee that someone will develop OCD. Despite these risk factors, OCD can affect anyone, regardless of age, gender, or socioeconomic status. How can one know if they have OCD? It's a question that many have pondered. Understanding the diagnostic process for obsessive-compulsive disorder, or OCD, is crucial to answering it. The journey to diagnosis often begins with a clinical interview. This is the conversation between the individual and a mental health professional, where they discuss the person's history, symptoms, and experiences. Following this, a psychological evaluation is usually conducted. This can include various tests and assessments designed to understand the person's mental state and symptoms in more depth. It's a comprehensive look into a person's mental health, and it helps in shaping a clearer picture of what they're experiencing. Lastly, the mental health professional will match the person's symptoms to specific criteria for OCD, as outlined by authoritative diagnostic manuals such as the DSM-5. Remember, these steps aren't just procedural formalities. They're crucial in identifying OCD and differentiating it from other similar conditions. Diagnosis is crucial as it paves the way for appropriate treatment. What signs might suggest that a person has OCD? Well, OCD, or obsessive-compulsive disorder, manifests through a series of recurring obsessions and compulsions. Obsessions are unwanted and intrusive thoughts, images, or urges that cause distress. A person with OCD might be excessively worried about germs or contamination, or they might have an overwhelming need for symmetry and order. On the other hand, compulsions are repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession. For instance, they might engage in excessive cleaning or hand washing to combat their fear of germs. They might arrange objects in a precise manner due to their need for symmetry. or they could be caught up in compulsive counting or checking routines. These symptoms can range from mild to severe. Mild symptoms might cause some inconvenience, but severe symptoms can be debilitating, significantly interfering with the individual's day-to-day life and their overall quality of life. Is there a way to manage OCD? Indeed, there is. Treatment for OCD generally involves a combination of strategies with the aim of helping individuals regain control over their lives. Cognitive behavioral therapy, or CBT, is a common method. This type of therapy helps individuals understand their thought patterns, equipping them with skills to identify and change irrational OCD-related thoughts. It's about breaking the cycle of obsessions and compulsions and learning healthier responses. Medications, particularly selective serotonin reuptake inhibitors, or SSRIs, are often used in conjunction with CBT. These drugs can help reduce the symptoms of OCD by affecting the balance of chemicals in the brain. In rare and severe cases where other treatments have been ineffective, deep brain stimulation may be considered. This involves implanting a medical device in the brain to deliver electrical impulses. Remember, it's important to consult a healthcare professional for a tailored treatment plan. With the right treatment, individuals with OCD can regain control over their lives. Can we prevent the onset of OCD? This is a question that many may ask, especially those who have seen its impact on their loved ones. The answer, unfortunately, is not straightforward. There is currently no known method to fully prevent obsessive-compulsive disorder. This is largely due to the fact that the exact cause of OCD remains somewhat elusive, making it a challenge to pinpoint preventive measures. However, early diagnosis and prompt treatment can go a long way in preventing the escalation of OCD symptoms. When the signs of OCD are recognized early, appropriate therapeutic interventions, medication, and support can be provided. This can limit the severity of the disorder and its impact on an individual's daily life. It's also crucial to note that a supportive environment, one that encourages open communication and understanding, can help manage OCD symptoms more effectively. While OCD cannot be prevented, early intervention can help manage symptoms and improve quality of life. How does OCD impact a person's daily activities? Obsessive-compulsive disorder, or OCD, can play a disruptive role in a person's everyday life. The time-consuming rituals, the intrusive thoughts, the constant need for reassurance, they can all interfere significantly with work, school, and personal relationships. Imagine having to repeatedly check if the stove is off before leaving for work, or spending hours washing your hands because they just don't feel clean enough. These behaviors can lead to tardiness, underperformance, and even job loss. In a school setting, children with OCD may struggle to focus on their studies, their grades slipping as their thoughts are consumed by their obsessions and compulsions. In personal relationships, the strain of OCD can be immense. Loved ones may not understand the need for these rituals, leading to tension and misunderstandings. The intensity of these symptoms can change over time, sometimes worsening under stress. The impact of OCD on daily life can be significant, but with appropriate treatment, these effects can be managed. Can OCD trigger other mental health conditions? It's a question that echoes in the minds of many. You see, obsessive-compulsive disorder, or OCD, is not an isolated condition. It has been found to intertwine with other mental health disorders, creating a complex web that can be challenging to untangle. Depression, for instance, is a frequent companion of OCD. The relentless cycle of obsessions and compulsions can lead to feelings of despair and hopelessness, paving the way for depression. Similarly, anxiety disorders often walk hand in hand with OCD. The constant worry and fear associated with obsessions can fuel anxiety, creating a vicious circle. Tic disorders, characterized by sudden, rapid, and non-rhythmic movements or sounds, are another condition often seen alongside OCD. The compulsive nature of both conditions suggests a shared underlying mechanism. Emphasizing the importance of addressing OCD is vital. By managing this condition, we can potentially prevent the onset of these co-occurring disorders. Remember, OCD doesn't exist in a vacuum. It can and often does co-occur with other mental health disorders. So, what have we learned about OCD? Obsessive-compulsive disorder, or OCD, is a mental health condition characterized by distressing, intrusive thoughts and compulsive behaviors. These are not simply habits, but actions driven by intense, persistent anxiety. The causes of OCD are still not fully understood, but a combination of genetic, neurobiological, and environmental factors are thought to play a role. Anyone can be at risk, but the condition often begins in adolescence or early adulthood. Diagnosis involves a thorough evaluation by a mental health professional who will assess the presence and impact of obsessions and compulsions. They are often time-consuming and interfere significantly with daily life. Treatment typically involves cognitive behavioral therapy, specifically a technique called exposure and response prevention. Sometimes medication may also be necessary. OCD cannot be prevented, but early intervention can help manage symptoms. It's important to remember that OCD can lead to other mental health disorders if left untreated. Understanding OCD is the first step towards supporting individuals who live with this condition every day.